Hi, and welcome to the podcast series Proctology and Laparoscopic Surgery. This is Dr. Manas Ranjan Tripathy, your minimally invasive surgeon and proctologist with you. Today we are going to talk briefly about advanced laser treatment for hemorrhoids or piles. Piles, or hemorrhoids, as we know, are very relatively common condition which is characterized by swollen veins at the end of the anus and rectum. This swelling and expansion of veins can have a number of different causes, like I have discussed in my previous podcasts, including chronic constipation, pregnancy, lifting heavy weights, anal intercourse, obesity, low fiber diet, continuous straining during bowel movements, or sitting for prolonged time in the loo. Sometimes hemorrhoids can be extremely discomfort and painful to those suffering from the condition and may also cause bleeding during the motions. Because of these symptoms, discomfort, bleeding, it's important to get it treated on time. Doctors make use of the most minimally invasive procedure to treat this painful condition in Bangalore and across the country. Now, what is this laser treatment for piles? First of all, the doctor or a proctologist, to be specific, they examine the cause and the gradation of your piles and accordingly suggest the best treatment for you. Our aim is basically to provide treatment through a minimally invasive procedure like a laser treatment so that there is least discomfort to our patients. The laser treatment performed to cure piles or hemorrhoids is called laser hemorrhoidoplasty. A laser treatment for piles is usually prescribed in the second, third, or sometimes even for fourth grade hemorrhoids. Because usually in the first stage or early second stage, we attempt to treat the hemorrhoids or rather control them using medicines and dietary changes along with lifestyle modification. We restrict our discussion today to laser hemorrhoidoplasty. Laser hemorrhoidoplasty is extremely effective method and takes very less recovery time as compared to other intense surgical procedures. Now, to give you an idea about what we exactly do in the laser treatment, when can this procedure be performed? A laser hemorrhoidoplasty is usually performed to treat grade 2 and grade 3 hemorrhoids. This treatment method is on the rise since this procedure ensures minimal pain and discomfort. In addition to treating piles, this procedure alleviates all the discomforts caused by piles, such as prolapse, bleeding, and pain. To briefly tell you all about how this laser hemorrhoidoplasty is performed. A laser hemorrhoidoplasty procedure is carried out using rays of a laser. The multiple companies supplying Proctology lasers, very advanced lasers, usually in the frequency range of around 1470 nm. The laser beams are applied to the target tissue, that is the hemorrhoids, which causes a fibrous reaction in the endothelial or inner cells of the swollen vessels and in the cells of the connective tissue. This reaction causes narrowing or closing of the blood vessels that supply blood to the hemorrhoids, which subsequently causes deflation of the hemorrhoids and they ultimately dry off. The fibrous reaction in perihemorrhoidal connective tissue makes the hemorrhoids reach back inside, hence solving the issues of prolapse of hemorrhoids. In other words, a hemorrhoidopexy happened. Now, why do we have to go for a laser piles treatment? Or what are the benefits of piles laser treatment over the conventional ones? A laser hemorrhoidoplasty, I would say, is a very minimally invasive surgical treatment for piles. It has a lot of benefits over traditional surgical treatment. Some of them include very low pain score. It makes use of energy which does not cause tissue damage and scarring, especially the perihemorrhoidal tissue or the normal tissue near the hemorrhoids do not get affected at all. This procedure is aesthetically best and helps the patient retain their confidence, does not require overnight stay in the hospital unless for other reasons. Very early return to the work and resumption of normal activities is usually guaranteed for the patients. Minimal chances of incontinence or fecal leak since the anal sphincter action is effectively preserved. There is minor or very less bleeding, and procedure takes hardly 15 to 30 minutes depending on the size of the hemorrhoids. Can be performed very effectively as a daycare procedure, and post-operative recovery is excellent. Now, what happens after a laser surgery? A laser hemorrhoidoplasty is done. Operative time is usually 15 to 30 minutes. Patients are usually discharged on the same day. Usually comprises of no cuts, stitches and wounds, and does not require any dressing. It causes a negligible amount of pain and no such discomfort. Patients are not required to make any particular dietary changes. They can go back to their normal diet within 6 hours of treatment. The procedure does not require the patient to stay admitted to the hospital overnight, and all the routine activities are usually resumed within 24 to 48 hours of the procedure. This is enough to know about hemorrhoids or piles laser treatment. That's a superficial idea. I hope you have a better understanding of it and have no fear about your hemorrhoids if at all they are. Thanks for patiently listening to me. I'll be back soon with another episode on a useful topic related to proctology and laparoscopy. Once again, this is Dr. Manas Ranjan Tripathy signing off.